Hi class, Dr. Jim here. In this lecture we're going to be looking at the reproductive systems. And so in this scenario what we're going to be talking about is how animals reproduce. And so obviously we've looked at asexual reproduction throughout a lot of the different lectures and that stuff, talking about mitosis and that. And then we spent a number of weeks, including week 7, we looked at meiosis with sexual reproduction. And then talking about how animals reproduce and using sexual reproduction as a way to do that. Well, in today's lecture, we're actually going to get into the nitty-gritty and actually look at the specific components of human sexual reproduction and see how humans actually go through this process. And so probably a lot of this is review and that, but it's always good to hear a good review and all the different systems and the different parts. And some of you may have never had any health class or any reproductive health parts or reproductive lectures or anything, so this might be some of these new things. I think the real interesting thing at the end, we'll talk a little bit about the STDs and other things that can affect you, and those are always something that people always have questions about but are always afraid to ask. So maybe we'll answer some of your questions today and kind of go through some of the different things that we're looking at. So let's take a look at the reproductive systems. Okay, so what are we going to be doing today? Well, first we're going to look at what are the various types of reproductive systems that animals have. And so I've already briefly kind of mentioned that. We're talking about asexual versus sexual, and what are some of the advantages to asexual and some of the disadvantages, as well as some of the advantages to sexual versus some of the disadvantages. And so we'll look at those things. And that kind of leads to the second objective point in looking at the advantage that sexual reproduction has over asexual reproduction. We'll then get into the major details of both the male and female human anatomy and kind of go through the different parts. And so again, most of that will be review, but it's always good to hear a good review and kind of see some of the parts, and maybe you know some of the major parts but missing out on some of the few. The important thing to get out of these two lectures is, one, think about how the sperm, where the sperm is made and how it travels through or from the testes through the vas deferens and out through the urethra through the penis. It's how the sperm move, and also the egg. The egg is made in the ovaries, travels down the oviducts or fallopian tubes into the uterus, and kind of know the pathways that are involved in that. And so those are some of the finer points that we're going to be looking at. And then finally, what diseases can affect the reproductive system. And so this will be going into, talk mostly about the STDs. We'll also look at some of the other viruses that can affect, and then finally talk a little bit about some of the cancers that you might actually experience in these regions and that stuff. And so why, if you see something or feel something that's not right, go and talk to someone. Even though it can be kind of embarrassing to talk about these areas and that stuff, it's always a good thing to kind of just go and talk to your doctor and have a good conversation, so that it might be nothing to worry about, or it might be something that they really need to look at. So that's what we're looking at today. So hopefully, you'll get something out of this lecture. So let's take a look. All right. So the first thing we're going to look at is asexual reproduction. And we've talked this numerous times throughout the semester, looking at different animals that can do this. And primarily when we talk about asexual reproduction, it means doing mitosis as a way to do cell division. And what happens is you have the offspring ends up being a clone of the parent. And so probably the most famous or most detailed one that we use a lot is the budding of the hydra. And so here's the hydra, and you guys remember this from a few weeks ago. And what happens is that the hydra can make a clone of itself and basically form a new offspring. So as you look here, the steps are, it starts to make a bud, it starts growing more and more, and finally it breaks off and becomes a whole new individual. Well, another type of asexual reproduction is actually what we see with the planaria. Now, planaria are interesting that you can cut the worm in 3 different parts, okay, and each one of those parts can develop into a whole new worm, and so that's called fragmentation, and this is another form of asexual reproduction. And so in these simpler animals that don't have a lot of systems and other things, you can easily replicate body parts and do these things. So really what you can do is take the worm, cut it into 3 parts, and actually generate 3 worms from it. And again, they're all going to be identical because they're all from the same parent. Okay, so what are some of the advantages and disadvantages of asexual reproduction? Well, some of the advantages are that it has quick reproduction and you don't need a mate. So that's very useful. So you can reproduce a large number of animals very quickly and not have to worry about finding a mate, which can be somewhat limiting, especially if you have a small population. And again, it really helps establish a very large population quickly. So if the idea is to have lots and lots of numbers, this is the way to do it, by asexual reproduction, because then you don't have to waste time finding a mate and going through the process of sexual reproduction. Now the disadvantage is that all the offspring are going to look exactly like the parents, and so you get no genetic differences. And again, the problem with that is that if you have changes in the environment that affect the parent, if they're going to affect the parent, they're going to affect all the offspring. However, one of the advantages of sexual reproduction is you mix the genes, so you might get a right combination that actually can survive environmental changes that don't mean extinction to the whole colony, and that's an important thing. Okay, so asexual is good at establishing really quickly a large population. However, the disadvantage is that you don't get any genetic differences, which can lead to severe problems if things change in evolution. Okay, so big problems there. Okay, so the other one is sexual reproduction, and again, most larger vertebrate and invertebrate animals go through the process of sexual reproduction. They use meiosis as a way to do specialized cell division, so again, they make sperm and egg and reduce the number of chromosomes that they have. And the good thing about that is that you mix the genes, and so you get a mixture of both parents, and so the offspring is kind of a mixture of the two parents, and depending on what their genes are. Now the advantages is that the gene changes of the phenotypes of the offspring, and so you get many different varieties of the same individual, and so that's helpful, especially if there's more or changes going on in the environment. And again, more differences in the genes, less likely that the offspring are not all going to survive and that you won't become extinct because of the environmental changes that can occur. So it really secures the population so that at least some of them will survive even if the harsh conditions occur and things like this. Okay? Now the disadvantages, obviously it takes much longer to establish a population, and the other issue is that you have to find a mate. And so that can be a limiting adventure as well, because we do have, especially in animal behavior and animal biology, where you have the alpha male who gets all the females, and that kind of plays a role with what genes get passed and that stuff. And so sometimes certain individuals might get left out because they can't find a mate, and so they can't find a mate, they can't produce offspring, and their genes aren't going to get passed to the next generation. And so that's the issue there. Okay, so that tells you a little bit about the differences between asexual and sexual reproduction and some of the advantages and disadvantages of both. But again, humans, we do sexual reproduction. Okay, so the next step is now looking at all the different parts that are involved in male and female reproduction. Okay, so the first thing we're going to start with is where the testes are. And the testes are held in a sac called the scrotum. And really the reason for the scrotum is to regulate the temperature, because sperm production is actually very sensitive to temperature. And so again, due to the body temperature, it can be too warm for the testes to actually make fully functional sperm. And so in order for that, if the body is too warm, the scrotal sac actually hangs lower, and if the body temperature is too cold, it actually will get closer to the body and warm up. So it's all temperature related and where the scrotal sac actually hangs from the body cavity. And so again, and that's due to the sperm viability at a certain temperature. Okay, so that's important. Temperature is very important for sperm viability. Now inside that scrotal sac you have the testes, and we actually looked at these during the week of meiosis, and so you may have seen this already, this slide already, when we looked at both the testes and ovaries. And what you can see here is that this is the testes. Now think of the testes as a big set of tubes all kind of intertwining with one another, and you're kind of taking a cut through the testes, okay? And so what you're looking at is a whole series of these different tubes in the different parts of sperm production. Okay, so on the outside, so you can kind of see the individual tubes. Here's an individual tube here, here's another one here, here's another one around here, and then you got this big one over here. And so these are all individual tubes of the testes. What you can see is on the outside of these are the primary spermatocytes. And so what they do is they're the stem cells that make the primary spermatocytes and get ready to make mature sperm. As you work your way down from the top or the outside of the tube to the center of the tube, so here's the center, it's kind of clear, you're actually going through the process of meiosis, and you go from the 46 in humans down to the 23, so that the mature sperm have the 23 chromosomes. Now you can tell these are mature because you actually see the sperm tails, and so this gives you a telltale sign that you have mature sperm because you actually see the sperm tails. And so that's the important step. And so the testes are responsible for the production and manufacturing of the sperm, mature sperm, going from the primary or stem cell, primary spermatocytes down to the mature sperm, which now have half the number of the chromosomes that you need for fertilization. Okay? The next thing we have is a set of tubes that are actually connected to the testes. So you can see here's the testes, and here's what I'm talking about with all the different tubes that are running through. So you can see. And what we're looking at is when we take a cut like this, and so you see all the tubes in the, kind of in a cross section. The next set of tubes are actually for storage, and so this is called the epididymis, and the epididymis actually runs behind the testes. So you have the testes, which is kind of the large ball feature or round feature that you have in the testes, and then there's a component that sits behind the testes, which is basically the storage unit, and this stores the mature sperm. And so you can look at these, and again, it kind of looks like the testes with all these different tubes, but this is the epididymis because now you don't see those primary and secondary spermatocytes. All you see in here are mature sperm. So you see all the sperm heads with the sperm tails, and this is just waiting for ejaculation to occur. So basically they store the sperm, again, keep the temperature constant so it doesn't fluctuate or change. This is part of the scrotal sac. That's why you hold the sperm in that area. Okay, and so that's the epididymis. It's used for holding the sperm. Now the next part is the tube that connects the epididymis to the urethra, and that's called the vas deferens. And so you can kind of see here in this picture here that the vas deferens runs off the testicle through the scrotal sac into the body cavity, and then behind the bladder, kind of runs along and behind the bladder to where it reaches the urethra at the back end of the urethra. Okay, so sperm actually take a long journey, and so the vas deferens is that tube. Basically, the vas deferens means just long duct, or a type of thing. That's kind of what it refers to as the duct, and it's the tube that connects the epididymis to the urethra, transports sperm to the ejaculatory glands ready for ejaculation. It's about 30 centimeters long, okay, and it has about 3 to 5 millimeters in diameter. So it's a pretty small tube, but it's a long tube in which the sperm actually travel down. And the muscular contractions that are generated during orgasm allow for ejaculation to pull the sperm out of the epididymis, up through the urethra, and then out the penis. And so that's what triggers the sperm out of the epididymis and into the vas deferens. So sexual arousal, and then finally ejaculation and the point of orgasm allows for the sperm to come out of these tubes. Now, some of you may have actually, if you're males, may have been told by your wives it's time to get the vasectomy, or you may have heard about the vasectomy. And what is it? Well, in this picture here, this is kind of gives you a good representation. So what they do as a doctor, they'll come in with a small little scalpel, they'll cut into the scrotal sac, and then they'll cut and tie off the tubes. So what they do is basically slice the tubes, or they may cauterize the tubes using a little heat gun, and they basically sever the vas deferens from both testes. So again, you still make ejaculate, which is made up in these areas up here. However, no sperm get mixed in. And so that's the important thing, no sperm, so it doesn't allow you to basically have any more babies at this time. And so this is one form of basically birth control, especially as you get older. If you've already had a number of kids and your wife says, no more, please, they might suggest that you go in and get the vasectomy. And what the vasectomy is, again, is cutting the vas deferens at those spots, and again, allowing for no more mature sperm to get in and into the urethra and out the penis. Okay, so that's the vasectomy part of it. All right, so the next part is kind of where the semen comes about. So basically in the ejaculation or ejaculatory liquid, we have two parts. We have the sperm, and then we have the liquid that is mixed in, and that's called semen. And that comes from the ejaculatory glands. And there's actually 3 different glands that are involved in ejaculation. The first one is the prostate. Now, most guys hear about the prostate because they only hear bad things. That one, it can get very inflamed and cause painful urination, either due to infection or age or other things like that can cause those things. The other thing that people hear about is prostate cancer, and that is a cancer of that gland. And so what happens is you get cancer cells that develop, and again, that can have effect on, again, urination and other things too, because of depending on the size. And again, it can be life-threatening depending on how serious or how long the cancer is gone for. And I'll talk a little bit more about the prostate cancer later on. What the prostate gland is there for is actually to secrete an alkaline fluid to help protect the sperm when it reaches the environment of the vagina. And so it helps raise the pH so that the vagina, when the sperm enters in, is very acidic. And so in order for those sperm to survive the acidic vagina, they have to have basic pH to kind of neutralize that pH or the acid pH in there. And so the prostate gland is very important for providing ejaculatory fluid that will help protect the sperm in the vagina. Okay, so that's the first one. The second one is the seminal vesicles, and the seminal vesicles actually sit on the side, and you can kind of, I don't know if you can see it here or not, but it sits kind of behind, here's the picture right here, kind of behind the prostate next to the vas deferens. And what that does, and here's the seminal vesicle here, and here's the prostate. And what this does is provides most of the fluid to semen. And so the glands are attached to the vas deferens, so as soon as the sperm comes down, the fluid gets added. And they secrete about 50 to 70% of the volume or the fluid found in semen. And this contains proteins, enzymes, and fructose, which act as the energy source so sperm can make it to the vagina, work its way up the uterus into the oviducts, and finally fertilize the egg at the top of the oviduct. So it's got to go on a long journey. It needs some energy and food for that to happen. And so the seminal vesicles provide that energy and protein for those wonderful sperm to make it to its destination. Okay. The last one is called the bulbourethral gland, or also known as the Cowper gland. And what this provides is the early lubricant or early fluid that is seen during ejaculation. So this fluid actually comes out early during sexual arousal, and what it does is basically get the urethra ready for sperm. And so again, during pre-orgasm, that you'll see some early fluid that's released, and this is the Cowper gland that provides it, and again protects the sperm as it makes its way through the urethra. It removes any residual urine that might be still in the urethra or anything else that might be in the penis, and allow the sperm to make its way to the vagina. The other thing it does is it lubricates it so that the sperm have a nice, fast, clear path to get out of the penis and into the vagina in that case. And that's the bulbourethral gland. And you can kind of see it's at the edge of the root of the penis. And so it's this little tiny thing that kind of sits below the prostate. You can kind of see it here. And again, it adds a little bit more fluid to the thing. And again, a lot of times it's kind of lubricates before ejaculation to get the sperm ready so that it can make its way out of the urethra in sexual arousal. Okay? Now, the penis itself is the tube that's used for insemination. Again, it's used to inseminate sexually receptive mates, and it's a carnivorous erectile tissue that allows, it becomes erect when filled for blood. And again, most of the time it's not erect because it's not needed for sexual transport or anything like that until it's necessary. And again, sexual arousal stimulates the penis, allows it to get erect, and again, used for sexual transfer of the sperm into the vagina. Okay, it's divided actually into three parts. You have the root, which is attached to the body cavity. You have the shaft or the body, which is basically where the blood is entered in and allows for the erection to occur. And then you have the head area, which is called the glans part. And again, the glans part is soft and sensitive bulbous tissue, which again has lots of nerve endings and is part of the ejaculation cycle, and so part of the stimulation and part of the orgasmic cycle for ejaculation to occur. And so lots of nerve endings on this, and again we'll see this type of tissue again in the women called the clitoris or clitoris, and so we'll talk a little bit more about it again, but the highly sensitive area, and again for sexual arousal and allow for the sperm transfer. Now, the last thing for the males that I want to just mention is the urethra, because the urethra actually serves as two purposes in men. The first thing is normally for urine, and so again, the urethra is actually attached to the bottom of the bladder and runs all the way through the penis. Okay, so that's the primary objective of the urethra. But it also attaches to the vas deferens in the back, and so depending on what needs to come through the penis at the time, that determines what's going through. Okay, typically there's a little trap door right here, and let me get my pointer, the trapdoor kind of closes off the vas deferens so that the urine can travel through the urethra and have no problem getting through, and you don't have any backups going on into the vas deferens. However, when the ejaculation is about ready to take place, what happens is that muscle contractions will actually close this trapdoor the other way and allow for the sperm and the ejaculation, the semen, to actually work its way through the urethra. Kind of like what the epiglottis does in the mouth, looking at, whether or not it's open for digestion or open for breathing. So again, one of those things. And again, it gets blocked off when the time of ejaculation is currently. But the primary use for the urethra is for urine itself. Okay? And so the last part that I kind of want to talk about with the men is the sperm and semen. Again, there's some different parts of the mature sperm. We have the head region, which again contains the enzymes to get in to the egg. So the very head part is called the acrosome, and those have enzymes that are allowing it to penetrate the egg. Behind that is the nucleus where the DNA is stored. Then behind that is the middle piece, which holds all the mitochondria. Again, the mitochondria needed to make ATP to flip around this tail so that it can get to its objective. And then finally, you have the tail, which is the flagella, and allows it to move and get to the egg where it needs to go. And again, you can see this here, where the sperm tails are necessary for the sperm to travel out of the testes and into the vagina, and finally to the ovary, or to the uterus, and then finally the oviduct. Okay, now semen, we've talked a little bit about this. This is the liquid portion of the ejaculate. It's produced by the ejaculatory glands. It's nourishing and protecting the sperm on their way to the egg. And again, it's a highly concentrated in fructose for an energy source, so the sperm have enough energy and energy source to get to the egg. Now, again, the journey can take a number of hours to almost even 24 to 48 hours to get to fertilization. And so that's a long journey for these cells to make it on their own. And so it needs all the help it can get. And so that's what the semen provides. Enough energy, enough support to get it to the rightful spot at the top of the oviduct here in a minute. And I'll show you where fertilization takes place. Okay, the last thing I'll mention about the males is, again, the testosterone. This is a very important hormone. We talked about hormones in the endocrine system. Testosterone is produced by the testes. Not only do the testes produce the male mature sperm, but they also produce the hormone testosterone. And again, this begins at the time of puberty. It first triggers the production of sperm. It also deepens the voice in males, causes facial hair and muscle growth. And then again, women do make a small association of testosterone, but not a lot. Okay, this is primarily a male hormone that's used, and sometimes you can tell these women bodybuilders and things like that will use testosterone, or you'll see that they use these steroids because they start to get male features. Their face gets more male. They might get hair on their face, sometimes on their chest and things like this, and they develop more man-like features. Their voice deepens and things like this. And even, again, women that go through the process and want to go from being women to men, what they'll take is testosterone, and you can see the drastic changes that happen to them by just taking testosterone itself. And so it's a very important hormone to develop the characteristics of what we see in a man. What ultimately controls all this is the pituitary gland, which is found in the middle of the brain. Again, we talked about this during the endocrine system last week, and so I just wanted to bring that up. So again, control the glands inside the brain, control the testes, which release the testosterone. And you can see here on the right all the different things that testosterone can affect. And so again, lots of different effects on men. And again, if women get in contact with it, can have effects on them as well. Okay, so that's the male reproductive system. So let's spend some time on the female reproductive system. Now, in the female reproductive systems, we have the ovaries, and the ovaries essentially are controlling the production of eggs. They're analogous to the testes in males, and that this is where meiosis takes place. This is where you get mature eggs, and then finally once a month you release these eggs. Okay, it's situated at the lower part of the abdomen, and again, they're kind of, if you look at it, they're really only attached by a ligament that attaches them to the uterus. Otherwise, they'd be kind of free floating out in the cavity, in the body cavity, the lower abdominal body cavity in this situation. So they're completely internal. Okay, they contain stem cells called oocytes, which are partially gone through meiosis, and approximately once a month, one oocyte matures and then is released. And so we'll talk a little bit about maturing the oocyte and going through ovulation and what happens during this process. Okay, the oocyte travels to the uterus where it becomes fertilized, and otherwise it gets reabsorbed if no fertilization takes place. Okay, so the next step is now looking at the fallopian tubes. These are the tubes that lead from the ovaries to the uterus. Okay, these are a pair of tubes connecting the ovaries to the uterus. They're finger-like projections that actually touch the ovaries, but there is an open space between them. So this allows for kind of like catching the egg once it gets released. And so these finger-like projections kind of catch the egg and then bring it into the oviduct. But sometimes it does miss, and what happens is the egg actually can fall through and actually end up in the abdomen. And so sometimes you can get a pregnancy that actually takes place in the abdomen. Very rare, but it could happen. The other thing I've actually heard too is that the other fallopian tube can actually reach over and grab the egg from the other ovary. So that can happen very rarely, but it can happen. And so there's been circumstances where they have that. So if a woman is missing a tube on one side, either due to endometriosis or maybe they lost it due to an ectopic pregnancy, the other fallopian tube can reach over and grab the egg in certain situations in that case. Not saying it always happens, but it has happened in the past. Okay? When an egg is released from the ovary, the ciliated cells of the oviduct actually force the egg down the tube, and so it kind of pushes it along, kind of moving it along so that it gets to the uterus. Okay? And the fertilization of the egg actually occurs in the tubes. And so where fertilization actually takes place is at kind of this bend in the tubes right up here. And so the sperm will make its way through the vagina, in through the cervix, into the uterus, and then again it's kind of has to choose the right tube in which the egg's coming down. And so they go, half the sperm go down one tube, the other half go down the other, and which one ever gets lucky and the egg's in, that's the ones that actually have a chance to fertilize the egg. And so then again, fertilization kind of takes place in this bend in the fallopian tube. Okay, the journey for the egg is about 5 days after fertilization. So fertilization, like I said, kind of takes place in the bend of the tube, and then the fast cleavage that we're going to talk about during development takes place, and then finally the blastula, which is about this stage here, actually implants about 5 to 7 days after fertilization. And so if the egg does not leave the tube and actually attaches here, that's what becomes an ectopic pregnancy. And an ectopic means that it's not growing in the uterus, but it's growing in one of the tubes or outside the uterus altogether. And so that's where if the egg doesn't make it into the fallopian tube and actually gets fertilized in the abdomen, that can take place too. And that's also known as an ectopic pregnancy. Okay. Now the uterus is where, again, is the pear-shaped organ where basically development of the new offspring occurs. It's a pear-shaped organ. It's about 7.6 centimeters long and about 3 centimeters thick. This is where fetal development takes place. So again, the fertilized egg will make its way down, the embryo makes it in, and will implant on one of these 3 walls here in the uterus and then grow into a new fetus. So any of these walls of the uterus are receptive for the embryo. The embryo will come and attach, and again, attachment is about 50% every time an egg is released and fertilized, so it doesn't happen every time, but about 60% of the time it does attach in this place. Okay, the endometrium is the inner layer, so this inner layer here is the endometrium that allows, it thickens every month and allows for the attachment of the embryo to take place. Okay. If no zygote implants, the lining is shed once a month, and that is what is menstruation. And so again, we'll talk a little bit about this in a few minutes with what ovulation is. Okay, endometriosis is when that tissue of the uterus actually grows outside of the uterus. And so you can have endometriosis, and here shows you a picture where it can actually grow inside the fallopian tube or the oviduct. It can grow on the ovary, and it can actually grow inside the digestive cavity, because sometimes it does make its way out of the fallopian tube and actually can grow on the organs themselves. And so one of the signs and symptoms is severe pain, especially during menstruation. So if you're one of those women out there that suffer really severe period cramps and other things, you might want to get checked out to see if you might have endometriosis. Also can play a role in having viable pregnancies, again, because endometriosis can actually block the tubes, and so no eggs can actually make its way down. So if you're having trouble to get pregnant, this might be one of the things that is causing the problem. You might get a thickening of the lining and actually block the tubes so that the egg can't penetrate down, and so that the sperm can't make it in and you don't get any fertilization. So that's something that you want to look at as well. And sometimes they can go in and clean the tubes out of the endometriosis. So again, another rule of thumb there. If you're having trouble getting pregnancy, you might want to check out endometriosis. Now the cervix acts as basically the gateway between the vagina and the uterus. And if you take it from the doctor's perspective, when they're looking, when they do a pap smear or checking out during the dilation of the cervix, this is what the doctor sees. And so it kind of looks like a donut shaped, and it has a small little hole, which is the entrance to the uterus. Typically there's mucus surrounding this, and again that's used to protect the uterus so things don't get into the uterus. Typically the bacteria and other things stay in the vagina. They don't get into the uterus itself or the oviducts, so that you don't have any bacterial infections in there, and so that remains primarily sterile. You can get some stuff, but typically it stays pretty much closed by the mucus so things can't get in. With the cervix, it's about 2 to 3 centimeters thick, and then during pregnancy you form a very large mucus plug that actually prevents pathogens from getting in, and leakage actually from the uterus from leaking out. And so again, a very important part during pregnancy, and that is the mucus plug. Now the last part of the female system is looking at the muscular tube that is known as the vagina, and this is basically for the acceptance of the penis, so that again sperm can get passed into here and then work its way through the cervix and into the uterus and finally to the oviducts. And so the vagina is typically anywhere from about 7.5 to 9 centimeters long, and it can expand and contract, and that again during sexual arousal. Normally has an acidic pH to prevent infections, and produces mucus to lubricate during sexual arousal and intercourse. And so a lot of this mucus actually comes from the cervix itself, and so we'll talk again, you'll learn more about that in A&P, but again, idea of the vagina is for the acceptance of the penis so that you can get sperm in there. Okay, provides both a discharge tube for menstruation and also in uterine secretion. So not only is it for an acceptor for the penis and sperm, but also as a discharge tube for the uterine secretions and anything else that needs to come out. And so one of two things. Now the last thing I want to hit about is looking at the external female anatomy. And so kind of, here you go, here's a nice picture for you guys to look at. It might make you a little uncomfortable, but again, this is important stuff to kind of look at, especially for nurses that might have to catheterize women. Again, very important is the urethra opening, which actually sits below the clitoris and above the vagina. So again, catheterization, very important. But you can kind of see here that the vagina really has, or the external female anatomy actually has 3 major parts to it. Okay, you have the vulva, which actually protects all the internal organs, and so these are the different parts to it. Again, the pubis part, the labia, which are the lips that kind of protect and surround the female anatomy, and then again also the urethra opening. Okay, you have the clitoris or clitoris, and again this is sensitive tissue. It's very similar to the glands or the head of the penis, again used for sexual arousal and that to get things working and getting things going, very similar to the penis. And then finally the urethra opening, which is very important. This is for the discharge of urine. Again, in women, they only use that tube for one thing, and that's for the discharge of urine. The tube is connected directly to the bladder, and so the urethra opening kind of sits in between the clitoris and the vagina opening. So again, for all you women out there that are going into nursing that have to catheterize, and maybe even some of you men that might have to catheterize a woman, there is an opening that's separate from the vagina, okay, for the urethra, just for you to know. And so there you go. There's the female external anatomy, okay? Now, one important thing that goes on in females is known as the ovarian cycle, and this is, again, the release of the egg. So once a month, women go through this process. It's governed by the endocrine system in women, and again, it takes you through the step-by-step cycle in women. It's typically a 28 to 29-day cycle. Now, this is, again, a very average type of cycle, so it's about a month long. However, some women can be faster. Many women are slower, and so they have, again, an ovarian cycle that could be 30 days, 35 days, even 40 days. And again, different things and activities that women do. If you're very athletic, you might have months where you don't even have a menstrual period at all because, again, it's due to the hormones being produced and what's going on. So if you're very athletic, do a lot of athletic training, you might actually skip periods here and there because of the hormones that are being released during that time. And so again, it's not one of those things that's supposed to happen every month. It can vary greatly depending on again, how the endocrine system is functioning. Okay, it's divided into 3 phases. Typically, you have the early stage, which is basically development of the oocyte. You have ovulation, which is the release of the oocyte from the ovary into the fallopian tube. And then you have what is called the luteal phase, which is kind of getting the body ready for a pregnancy. And so again, these are all important steps to kind of get ready for the pregnancy. If you're one of those women that are really trying to get pregnant, the best day to conceive would be around that day 13 to 14. And some women can actually tell when they're ovulating because they might get some pain around that time because you actually feel the ovulation occurring. Now, most women don't feel that pain, so they won't know, but a good rule of thumb is about 13 days after the start of their period, that would be a good time to have sex because that would be an optimum time for fertilization to occur. Now, again, if your cycles aren't at the 29-day stage, it might vary a few days here or there. So you might have to play around and look at those things and figure out what's the exact time of your ovulation. And again, there's kits out there to look at those things. Also, you can do temperature and other things like that. There's a lot of different things that you can do to kind of try and plan your pregnancy. All right, so also kind of getting into a little more detail, the follicular phase is the time when the ovarian follicles or oocytes mature, and that's the first 12 days of this. So starting with day 1, so the first day of your period, to about day 12. Then ovulation occurs on day 13 or day 14. This is when you get this rapidly release of hormone. This release of hormone triggers the release of the follicle from the ovary. And again, sometimes you can get some discomfort called Mittelschmerz, and Mittelschmerz is the pain that you might feel in your ovary, and that's the release of the egg. And then you have the luteal phase, which is basically the remaining parts of the follicle, which actually produce hormones to stimulate the uterus to get it ready for a pregnancy. Now, if the lady does have an embryo that ends up implanting in the uterus, this thing will continue to produce hormones until week 8. However, if there's no pregnancy detected, and again, there's signals and signs from the body, if there's no pregnancy that's detected, what will happen is that it'll get another sign and symptom, these things that will then lower the amount of hormone will lower, and then you'll shortly after the lowering of the hormone will have menstruation occur and the shedding of the lining. And you can kind of see here showing you what the uterus looks like. So on day 1, you have the start of your menstrual period. At day 10 to 12, it's normal. Then it continues to grow until, again, about day 28. And again, depending on what happens with the egg, if the egg implants, this will continue to grow and maintain its size. If there's no embryo that implants, then this lining will get shed and you go through the process of menstruation again. Okay? And so that's the typical ovarian cycle. Now, some of the hormones that are produced by the ovaries include the estrogen. Again, plays many roles in female development. And again, at about the time of puberty, estrogen is produced. So that's when women or young girls will start to see breast development. You see an increase in metabolism. You see an increase in fat stores. So you start to get fat in places. Again, and that's for childbearing purposes. You get the thickening of the vaginal wall and increased uterine size. So again, getting ready for childbirthing, and then promote a bone formation so you can support and handle a pregnancy for that time. Also, you'll begin the ovarian cycle and menstruation, and so we see this. And men do produce a small amount of estrogen from the testes, but again, very limited amounts, very small amounts. And there's actually 3 different types of estrogens that are produced by women. It's not just one, but they kind of blanket it all together in one form called estrogens, and just letting you know what those things are. Now, the other thing women produce, and this is especially important for pregnancy, is progesterone. Progesterone basically is used for the uterus to accept an implanting fetus. And so this is the molecule of progesterone, and it maintains early pregnancy. So this is produced by that follicle that remains behind, or the leftover remains in the ovary, and it produces this progesterone to maintain a pregnancy. And again, some women don't produce enough progesterone, and sometimes they have to take a shot. So sometimes what will happen is that you have early miscarriages, and that's because your body's not producing enough progesterone. So what the doctor might do is just prescribe you some estrogen or progesterone shots so that you take a shot a day to maintain that pregnancy for the first 8 weeks. And then once the placenta has developed, the body will take over, the placenta will take over, and you no longer have to do the shots. And so again, what this does is help maintain that pregnancy in that early stages during the early development. It also increases the core body temperature, so this is one of the signs for ovulation. And then it also will help stimulate mammary gland production to start producing milk for offspring. So again, during the process of pregnancy, women's breasts develop again, and then they begin lactation right around the time pregnancy begins. And so this is another important step, and again, due to progesterone and estrogen that's produced during that process. Now, the last thing I'm going to talk about in this lecture is probably what you've been waiting for, and that's a little bit about the STDs. Now, again, STDs can be bacterial in nature, they can be viral in nature, and they can even be sometimes protist in nature. And so it can be one of all three of these different things that we look at. Okay, the typical, most of them that most people, or I should say most people suffer from, are bacterial in nature. The problem with a lot of these things is that a lot of times you never see symptoms, and so a lot of people end up being asymptomatic and actually pass this disease without even knowing they have it. And so the first one that we're going to look at is gonorrhea. And gonorrhea is a bacterial infection of the genital tract of both men and women. You can kind of see it's a gynococcus, it's called. It's typically diplococci in nature, two of the circles here. Again, round bacteria. Most men have symptoms when they're infected with it. But however, 70% of women, or over 70% of women, do not have any symptoms whatsoever. So they get infected with it and then they don't have any symptoms. This is the second most common STD infection in the United States. And if you look at it, again, some of the symptoms that you might have when you experience gonorrhea, and again, a lot of people are asymptomatic, but if you do have symptoms, one of the main signs is painful urination, some unusual discharge either from the penis or vagina. In men, you might have swollen testicles. You may have unusual vaginal bleeding during the time. In women, you may have lower stomach pain or pain during sex. And all these are symptoms of something wrong that shouldn't be there. And so again, if you have any of these symptoms, you should go get it checked out by the doctor. Now, the most common bacterial STD is actually called chlamydia. And this is, again, another bacterial infection of the genital tract. You can actually see here, chlamydia actually is one of those that actually gets into the cells and the mucous membranes of both the vagina and the penis. And so again, about 50% of men have symptoms, and again, 60 to 80% of women are asymptomatic. And so again, high number of women who get infected never have any signs or symptoms. This can lead to sterility if untreated because it can cause scarring of the fallopian tubes and block the tubes so that you no longer, or scarring of the urethra as well, so sperm can't be released or very ineffectively. And again, this is the most common type of STD in the United States. Again, most often, no symptoms in either one. However, similar symptoms to that of gonorrhea is painful urination, lower stomach pain. Sometimes you will get fever. Sometimes you'll get a slight discharge from the penis, more vaginal discharge than usual, and then again, slight bleeding. And again, in women that don't show any signs or symptoms, again, one of the things that they'll test for you if you're having problems having pregnancies is they'll look for STDs. So what they look for is actually antibodies or proteins you produce against these different bacteria. And so that's how they can tell whether or not you have an infection going on. Okay. Another bacterial disease is called syphilis, and syphilis is actually a spiral-shaped bacteria. And again, this is a bacterial infection. And again, the problem with syphilis is that this one can be maintained for a long period of time. Now, with both gonorrhea and chlamydia, they tend to stay in the genital tract region. And so those are infections that tend to stay in that area. With syphilis, this can actually move away from the genitals and actually affect other body parts later in life. And so again, they generally form lesions very early on. And so what you have are these early lesions. In the first 10 to 90 days after infection, you get this thing called a chancre, which is a very hot, fiery pimple on either the penis or vagina. Then after, you can have secondary eruptions which occur on the skin and other areas. And then finally, anywhere from 10 to 30 years later after the primary infection, you can have tertiary disease where the syphilis actually can go to the brain and lead to dementia. So it can cause some long-lasting effects in syphilis. And so some of the people that are actually in these retirement communities today are actually probably suffering from dementia that they got from syphilis and never knew that they had long ago. Okay, so one of those things that you might want to worry about. Now, a common viral disease that people get is herpes, and herpes in the genital region is caused by herpes simplex virus 2, or HSV2. This is a recurrent infection, and once you get it, you can never get rid of it. The bacterial diseases can actually be treated with antibiotics, and again, you can treat it and actually cure the disease. However, with things like herpes and HIV, there's no cure for it, and so once you get it, you have it the rest of your life, and so that can be an issue. Okay, you form blister-like lesions in the genitals, and here's some of the lesions that you might see and the areas that you might see it on. So on the shaft of the penis or around surrounding the vagina. And again, you see these blister-like clusters that form. Okay, the virus then hides back in the basal ganglia of the lower back, so it then travels back along the nerves and back in the spinal cord, and then it can hide for a long period of time. So when we talked about viruses hiding, these are one of those viruses that hide for a long period of time and then comes back. And again, no cure. This thing is with you with the rest of your life. So if you get it, unfortunately, you're going to have it the rest of life. And again, there are treatments where you can lessen the signs and symptoms of it. However, there's no cure to get rid of herpes in general. Okay. Now, the last disease that I want to talk about is HIV. This is a viral infection that typically is spread through sexual contact. The virus does not remain at the site of infection, gets into the mucous membranes, and then gets into the blood, where it can affect and attack the immune system. And so what it does is it affects and attacks the T cells specifically and attacks your immune system. Okay? And that's the big problem. It eliminates the T cells and weakens the immunity. And then what you end up having after a long period of time is this acquired immune deficiency syndrome, or what is called AIDS. And again, this is when the level of T cells lowers below a normal level, and you get this situation where now you're starting to develop these secondary opportunistic infections that most people would never get if they didn't have this disease. And so where most people die is not due to the HIV itself, but they die to the inability to fight these normal infections. And so that's a real big problem. So that's another disease that can occur. Now, the last thing I promise, and then we're done with this, is talking about cancers. So the two cancers I'm going to focus in on is cervical cancer in women and prostate cancer in men, because these are both very important cancers that can occur. Now, cervical cancer is basically abnormal growth of cells on the tissue around the cervix. 90% of the cases is actually caused by a disease that's passed by a virus that's passed during sexual contact called HPV. And so women now, young women, are actually getting vaccinated to prevent the spread of this HPV. And so what happens is the virus spreads, ends up on the mucous membranes of the cervix, enters in, and can cause basically cell changes of the cervix. Now, one of the things women should do yearly is get pap smears done as a preventative measure so that they can screen and make sure that you don't have any abnormal cells growing. So here is an abnormal looking cervix seen through a speculum. And so this is what the doctor would see, and this would be a very aggressive stage kind of cancer. Now, the reason why I bring this up, this is the 4th leading cause of cancer in women. So again, get your screenings done so that you don't have any abnormal cells. Again, if you've been sexually active in the past, you should go in once a year, have a pap smear done to make sure that everything is normal. And what they're looking for is abnormal cells when they do that. Okay? In men, that cancer is called prostate cancer. And basically, this is abnormal growth of cells on the prostate. So again, here's the prostate. It surrounds the urethra. And again, you can have various sizes of growths depending on how long or what grade this growth has been going at. Early prostate cancer causes very few symptoms, so most men don't get screened in time to actually catch it very early on. It's only when you start to see symptoms, and some of the symptoms include painful urination, frequent urination, nighttime urination, and blood in the urine. And until you do those things, you're not going to really get it screened for. So again, one of the things men should do is get yearly checkups, get screened, and again, it's not the most comfortable thing, but basically what it's doing, what the doctor's doing, is checking the size of the prostate and looking for any abnormal features that he might feel in the prostate. And again, this is the most common type of cancer in men over 50 in the United States. So again, this is one of those things that men, especially once they reach that age of 45 to 50, should start getting yearly screenings to make sure that their prostate is functioning normal. Okay? And so we're now to the end of the lecture. So again, we've covered a lot of different things, most of it probably review, but hopefully I've answered some of your questions, especially with the STDs and some of the cancer stuff. So again, there's two types of reproduction that occurs in animals. Some use asexual reproduction. Typically, the lower level invertebrates tend to use asexual reproduction. Again, the problem with that is that you have no shuffling of genes or no changes in the genes, so the offspring look exactly like the adults. The problem with that is that if you get environmental changes, it can affect the whole and wipe out the whole population. Most animals above a certain level use sexual reproduction. This is where two partners are involved. The cells go through meiosis, the special reduction of the number of chromosomes, and you get a mixing of the genes. Why is it advantageous? Well, again, because you mix the genes, you will create a very different or very variant population. So again, they can survive different extremes that can happen at different times. And those variances actually keep populations alive and prevent extinctions from actually occurring. Okay? So again, another thing to know your major organs of the male and female reproductive systems, be able to trace sperm through the testes, out the epididymis, through the vas deferens, through the urethra, and out the penis. Okay? So that's one of the things you should know. For females, the eggs start in the ovaries, get into the oviducts, work their way to the uterus, and then finally that's where they implant. And so knowing these different things. The ovarian cycle is a very important process to create life, and again, 3 phases are involved. You have the follicular phase, which releases or which gets the eggs ready. Then you have the ovulation, which is the release of the egg from the ovary, and then finally you have the luteal phase, which is in preparation of the uterus to receive and implant the hopefully the fertilized egg and embryo at that time. And again, the last thing we looked at was the number of sexually transmitted diseases, along with cancers, can be life-threatening, especially left untreated. So again, this is not the most comfortable thing to speak with your doctor, but if you do have any of these signs or symptoms that you do see with this area, don't wait. Get it checked out. Don't be embarrassed by it. Doctors have seen everything these days, so don't feel embarrassed talking to your doctor about these things to your doctor. They're there for a reason, okay? These signs and symptoms are telling you something. If something's not right, get it checked out. All right? With that, we've come to the end of the lecture, and so we've talked a little bit about all the reproductive parts and that, good review and that stuff. If you have any questions, you want to know more about STDs or anything else from me or Jill, please feel free to ask us and that stuff during class. I thank you for watching, and I'll see you next time.